Hi, today we'll be discussing about a very important topic that is called as testicular torsion. We know that in every male, in every man, there are two testicles in the scrotum. They are hanging by a structure called as spermatic cord. So imagine what will happen if this spermatic cord gets twisted. So this is a cord through which the oxygen and the blood supply which reaches the testicle. So by any chance, if this cord gets twisted, then the blood supply and the oxygen and the nutrition to the testis will stop. So this twisting of spermatic cord is known as testicular torsion. So why is it important? When the blood supply to the testicle is occluded, that means the oxygen and the nutrition is not reaching to the testicle, it will die and it can lead to permanent loss of that testicle. So that's why it's important. And it is a very time sensitive condition. That means it's an emergency. If the intervention is not done well in time, then it can lead to loss of the testicle. It has been seen that this untwisting of the spermatic cord, if done within 6 hours, can lead to complete resolution of the problem. But if the time lapses, then almost 50% of the testes will undergo permanent damage in next 6 hours. That means 6 to 12 hours. And after 12 hours, the chances of survival of the testis becomes very less. In such people where the testicular torsion occurs, the intervention has to be done very fast. Now, how to identify a testicular torsion? So I'll tell you the symptoms. Sudden, sharp, severe pain in the testicle is one of the important symptoms of testicular torsion. The person is sitting normally, comfortably, or he is lying down in the bed and he starts with sudden sharp pain in the testicle, which doesn't get relieved. Number 2, swelling of the testicle, swelling of the scrotum. Number 3 is nausea, vomiting. And number 4, the testis on the affected side may be little lifted than the other side. So what to do in such conditions? See, it's very difficult to figure out what's wrong, and since this is a matter of grave concern, so best thing in such condition is that when there is severe sharp pain in the testicle on one side, either right or left, immediately rush to the nearby doctor, nearby urologist, or a nearby emergency hospital and let yourself get examined so that the diagnosis is made. Because if untwisting is done in time, then it can save the testicle. Testicular torsion is more common in the teenage group, and average age of torsion is around 15 years. However, it can occur at any age.